Welcome to this installment of Town Hall Tuesday. We're welcoming 4 of our independent insurance agent members of the North Carolina General Assembly, one of whom, Senator Todd Johnson from Union County, is not able to join us right away. He's got some other things he's working on, but should be joining us shortly. But we're very fortunate to have with us today Senator Vickie Sawyer, the senator from Iredell County, Senator Jim Bergen from Harnett County, and Representative Kevin Corbin from Macon County up in the far western part of the state. And thank you so much for taking time out of your busy day for joining us for a conversation about some of the COVID-19 legislative issues that our members would be interested in. Thank you all for being with us today.
Thank you, Joe.
Thank you.
Thank you.
Well, let's start this. I think most of our members are pretty well acquainted with each of you, but I thought it would be also beneficial to give you a chance to give a little bit of your own background, your bio, and how you came to be in the insurance industry as an agency owner. Senator Sawyer, why don't you go first?
Sure, thanks for the opportunity. Like you said before, Iredell County is my home, and Mooresville is where we have an independent agency with 2 locations. I did not start out loving insurance. I fell in love with a man who his father was a State Farm insurance agent. So we went from captive to independent in 2002. My husband and I went out on our own, and so I've been an agency owner ever since, and it was the best decision other than becoming a senator that I've ever made. So that is now we get a chance to affect laws and change and help our industry grow.
Representative Corbin?
Yes, sir. Thank you, Joe, for having us on today. I represent the far western 4 counties of North Carolina. As you know, every House member represents about 84,000 people, and you have to draw a pretty big circle to get that many people in it out this way. So I represent Macon, Clay, Cherokee, and Graham counties. I'm in my 2nd term in the House. Prior to being in the House, I served actually 5 terms on our local school board and chaired that for 16 years. I was chair of the county commissioners for about 5 years before running for this seat. So I went to Appalachian State, got a business marketing management degree up there, and upon graduation, I had been offered a job with a local bank, and I had talked to my uncle who was in the insurance business, and I thought, you know what, I'm going to try this insurance thing, and if it doesn't work out, then I'll go to the bank. And so far, I'm still seeing if it's going to work, but 30 years later, we're still in the business. But I'm an independent insurance agent here in North Carolina. I've also got an agency in upstate South Carolina, and down there, here we do pretty much everything. Down there, we only do health insurance, primarily, well, under 65, but we really focus on Medicare. So that's kind of my business model.
Senator Bergen?
Thank you, Joe. It's an honor to be with you today. I represent Harnett, Lee, and part of Johnston County. Live in Anger, North Carolina. I've got an office in Anger and another one in Lillington, and then I'm chairman of New Horizon Insurance Group, and we have 10 members all the way across the state. Got in the insurance business. I actually went to the University of Tennessee, was recruited by a $1 billion company and went to work for them for 8 years, and ended up being director of marketing and transportation, which included the insurance department. So I got involved in insurance early on. And then when Ann and I started having children, when our first daughter was 18 months old and I was traveling 4 days a week, I said, I don't want to keep doing this. Moved back to her hometown and bought a little insurance agency, and God's just really blessed it. And I got into a lot of other businesses, and now I'm in the car business and just real estate, and a lot of things. Just enjoy business and everything about it. And I was county commissioner for 8 years and was chairman of that, and kind of got the political bug and saw that some things you could do locally, but other things were going to have to be done statewide. So when our local senator decided not to run and to retire, Senator Raven, I ran for that seat and was honored to win and be able to represent folks, and have thoroughly enjoyed it. Enjoyed the minutia and the detail, and actually I think all of us freshmen have enjoyed working together. I know I've sure enjoyed working with Vickie, and even though Kevin's not a freshman, Kevin and I have been friends for, I don't know, 20 years or so, and have really enjoyed working with him. And and with Todd and Joe with you. We've been having a lot of fun working together. So this has been a great experience.
Well, you've been great, not just on issues that matter to the independent insurance agency community in North Carolina, but on a lot of issues. And I always say part of the benefit of having somebody that owns and operates an agency is that you've had plenty of real world experience sitting across a kitchen table from families who are trying to figure out how to make things work. And so you bring a great disposition on a lot of matters of public policy outside of the realm of insurance. And so it would be my goal. I don't want to have all 170 seats in the General Assembly filled by independent insurance agents, but slightly over half would be a good number.
A clear majority.
Well, Senator Burke, it comes straight back to you. What have you seen as the impact of COVID-19 on your agency and on the customers you serve and in the community where your agency is located?
Well, we decided early on that we were going to be careful but unafraid. And so for the benefit of our folks, what I did was post signs that said that we were open, but it would be by appointment or they just make a phone call. We'd be happy to receive folks, take payments, have meetings. We did lock the front doors for a few weeks. We did open them back up, but I told my folks, you know, if you're not feeling well, don't come. If you're worried about it, talk to me. I want to err in your favor. If you want to wear a mask or a N95, we will make sure that happens. But I wanted folks to be comfortable, but to know that they were very important to the community. And you know, we haven't missed a beat. In fact, we're writing a lot of business, writing a lot of new business. And being in the car business, I was concerned about that. We kept those businesses open. And Joe, I was telling you earlier, we had the best April that we've had in history. So it's just been amazing. Business is going on. I think people are naturally being careful, social distancing, and doing a lot of things. But we've treated this carefully, but we've not stopped our business. We've never closed our doors.
Senator Sawyer, you're very active in your community, even before you ran for the state Senate. How are you finding things there?
Yeah, so a lot to what Jim said, but it's a little different because we are in a suburban area and very rural. That's my district. And I think the more rural you get, the more not understanding what these orders are, why they are, because the big joke is they social distance all year round, right? That's not, you know, Yadkin County folks, they're, you know, they practice that as a living in the way they are. You know, I think for me, and I know a lot of agents on this phone or on this call will say the same thing, it is heart-wrenching to hear those small business owners that we have insured calling us. They cannot get through the unemployment system. They cannot open their doors, and they don't know where their next meals are going to come. So I'll say that the community itself has been good. I think there's a general sense in Iredell and Yadkin County that they're done and they want to reopen. And they also are worried about those small business owners to see that, you know, that they will ever reopen their doors. I think, what is it? 1 in 3 restaurants now are not going to be able to reopen in North Carolina. And so for me, it's been an emotional toll as I hold the hands of not only my constituents, but my customers. And quite frankly, those businesses that are being shut down, 60% of those are female-owned businesses, or you know, and so you're looking at these, you know, folks that are females who are sometimes the only breadwinner and they in their family, and they're not able to feed their children. So it's been a very emotional toll, I think, on me and my district for sure.
Senator Johnson, I see that you were able to join us now. I appreciate you taking time. I know you're very busy. Take a few minutes to introduce yourself, talk a little bit about how you came to be in the insurance business, and then interested to hear what you're finding in your district in terms of the impact economically from COVID-19.
Well, hey, Joe, I'm sorry it took so long for me to get on, and I apologize for the great lighting that I have in my little man cave here that it was the only quiet place in the building that I could find, so I apologize for that. If you would be so kind as to repeat the question for me one time now that I'm actually paying attention.
Yeah, sure, absolutely. Real quickly, just give your bio, how you came to be in insurance agency business, and then talk a little bit about what you're finding there in Union County in terms of the impact from COVID-19 on the local economy.
Yeah, well good. Thank you again. As far as being in insurance, it's a family-owned agency. My dad started when I was 13. So at age 13, I was basically filing and working in the office and doing all the stuff that, new agents don't even know about back in the day where you had the big file cabinets and all that good stuff. But been around that basically my whole life. I don't know a lot about a lot of things, but I know a little bit about insurance just because it's basically what I've done my whole life. So in, 2000, I graduated from Chapel Hill and went back to a little town called Wadesboro, which is where I'm from in Anson County down on the South Carolina line. And my dad come up to me and said, son, I know you want to work in the family business. Wadesboro is not big enough for both of us. You need to go to Union County and start an agency and I'll help you, whatever. So since then I started an agency from scratch, and anyone that started an agency from scratch will tell you it's not fun. It's not easy. It takes a lot of work. And about a year into that, I'm like, yeah, this pretty much stinks. So I said, it's going to be a lot better if I just go buy agency. So I bought an agency, and then I liked that. And so then I just started buying agencies. And since 2002, I've purchased about 18 agencies and merged. And today we operate with 8 locations. And it's pretty fun, pretty enjoyable. But coming back to Union County and COVID-19, we have, we sit kind of like Senator Sawyer. We are sitting right beside Mecklenburg County, which has the highest count in the state. And we are definitely a bedroom community to Mecklenburg County, especially on the western part of our county. So many of our citizens obviously sleep here, but they work and they quote unquote live in Charlotte. So we were really concerned at first about the spread kind of coming into Union County. But what we've seen is, I think everybody believes their community is the best, but Sweet Union, we are a very resilient people, and we love to work. We love to get out in our communities. We love to go to church, go to the parks. We just like to talk to people and go see people. And so it's been very difficult for us from our social standpoint, but at the same time, folks understood the risk, and we are primarily a conservative county. And what you learn pretty quickly is that conservatives like to follow the rules. We want to obey the law, and I'm not saying that if you're not conservative, you aren't those things, but for the most part, we are going to listen to what folks are telling us. But what I'm seeing now is people are, for lack of a better term, are done. They're kind of past all this. They're ready to move on. They've done all their landscaping they can do. They've done all their housework that they can do. They're ready to get back to some form of normalcy, whatever that is. And we're seeing where I'm situated now is actually in our one of our shops up in Indian Trail, which is literally right at the Mecklenburg County line. And the traffic on the road in front of the shop here is unreal. I mean, it is bumper to bumper. People are out and about. People are ready to go back to work. And so there has to be a balance, I think, between safety and security, and also the ability to live and have freedom. So one thing I've said multiple times is, everybody likes personal freedom, but with personal freedom comes personal responsibility. And so if you're willing to take on that personal responsibility, then you should be willing to be given or made sure that the personal freedoms are protected. And I think that's what our job is, especially in the legislature, is to make sure that we are protecting that freedom. One other thing I like to tell people is, our freedoms are not given to us by the government. And so it's really not theirs to take away. And so I'm hearing that a lot here in Union County also. Folks are just ready to get back to work. But any other questions? Sorry, Joe, when you give me the mic, I'll get on and I can talk forever. And I know my colleagues here can vouch for that too.
No worries. But Representative Corbin, part of the state you represent, far western area, your family has been there so long. It's my understanding at some point there was discussion about calling the state North Corbin, but because Caroline had so much influence with the king, the decision was made to go with Carolina. But you've been in Western North Carolina for generations as a family. You've seen a lot of changes take place in that part of the state. How are you seeing this impact in Western North Carolina, and what do you think will be the way forward for Western North Carolina?
So I would agree with a lot of things my colleagues have said. But as you mentioned, Joe, my family's been here. We've been in what is now Macon County. We've been here since 1830. And then we came from the eastern part of the state in Haywood County. So we came 2 counties over. We've been in Western North Carolina for a long time. kind of agree with Senator Johnson about the way folks are dealing with this. I live in a very, very rural area, I guess the most rural of the four of us. And folks out here pretty much follow the rule. We have almost no cases. We've got, I was looking over a list this morning in Graham County, which is my district, was two cases. Macon, where I live, got 3. Clay, there's 5. So just not many. Cherokee County has 18, but they had someone was from Atlanta, came to a gathering at John C. Campbell Folk School right before this thing broke, and apparently infected all the people there came from one source. But I think we're ready to get back to some kind of normal life too, and there's got to be a balance between the freedom and safety. And I would agree with what Senator Johnson said, that folks out here are kind of independent thinkers, mountain folks, Scotch-Irish descent, most of us, which brings with it good and bad things, kind of bullheaded at times. But as Todd said, we tend to follow the rules. We've been social distancing here for 200 years. There's not many people. So I think that's why there's not been as many cases. And people are following the rules, but I think it's time that we start moving back open as we've all shared in one way or another. I think we're moving from a time where the government said, okay, we need to shelter everybody, stay away. I think we're moving into a time now where it's kind of personal responsibility. It's Kevin's responsibility for me and my family, just like it's Vickie or Todd or Jim's responsibility for them, their employees. Moving forward, we have to understand this virus is not going to go away. I just wish we could just wake up tomorrow and it be gone. It's not going to happen. As long as you have people who are infected and then you have people who haven't gotten it yet, it's going to continue to spread. So how that's going to play out, I don't know. I'm not an epidemiologist, but I didn't even know that word epidemiologist until 6 weeks ago. But we're doing fine out here. Folks have been kind of staying quiet, but as some of my colleagues said, it's starting to get a little busier out there. We're seeing a lot more people get out. Most businesses appear to have opened this week. So moving forward with our insurance agency, go back to that question, we have done a lot like Jim said. We have decided to be cautious, but we've remained open, and we work by appointment, and we try to keep our distance from folks. We're not shaking hands and those kind of things, just out of respect for folks who are fearful of getting the virus. But we continue to serve our constituents and our customers during this.
Well, the IIANC CEO, Albie Knight, who's the usual host of these, is traveling today, and that's how I came to be the guest host for today. But he did remind me to be specifically appreciative, express on behalf of our membership, thank you to all of you. You've been tremendously responsive during this past several weeks of uncertainty. Every time we've had an issue or needed some clarification, you've been great and very responsive, and we appreciate that very much. And one of the things I wanted to talk about in this session as well is the most recently concluded legislative session, what was going to be the short session, the usual time when the General Assembly comes back to Raleigh in the even-numbered years to discuss issues associated primarily with the second year of the biennial state budget. But this session was dedicated exclusively to COVID-19 response, not the least of which was the apportionment of some portion of the $3.5 billion that the state had received from the federal response to COVID-19. And Senator Sawyer, why don't you lead us off, touch on maybe one or two of the key things that you think this audience of independent insurance agents would want to know about what was contained in the COVID-19 legislative package.
Yeah, so thank you for the opportunity, because one of the things that I really was excited that we did is a little bit of professional liability out there for some of those folks who were providing not only healthcare, but those manufacturers that retooled their equipment so that they could do masks, for example, or some. We have examples in all across North Carolina, those folks who retooled at the president's request. And us as insurance agents know that you know, that first of all, we don't have liability for something that we just, you know, started doing, and let's make sure that there's some hold harmless provisions in there. So we wanted to go a little bit further, but of course those dastardly trial lawyers got a hold of it, and we couldn't expand that. But I do still know that at least on the Senate side, we're looking to make sure that we give some protection to businesses, because there's some real questions. Like, we're all small employers, so you think about it, if someone's afraid to come back to work, but you ask them to come back to work, well, you know, where are we at if you should choose to fire them? Or, you know, what kind of protections are going to be? And let's also look for like reopening, which I'm a very big fan of, but we really have not received direction from DHHS what a restaurant should look like in a post-COVID environment. So how do we allow those small business owners to reopen, but do it safely, so not only that they not transmit the disease, but also they protect themselves from undue liable claims? So the small questions like, do you even keep ketchup on the table anymore? You know, does everybody have to eat out of styrofoam, or can you do glass? Those kind of things and directions have not been given to the governor or from the governor's office just yet. So I hope that those conversations are going on, but as small business owners, we have to be very careful that we don't open ourselves up to liable claims.
Representative Corbin, other things that you are particularly interested in making sure folks listening to this broadcast know about in terms of what was contained in the package?
Well, it was a very large package. I think the legislation was over 100 pages, single spaced. So there was a lot to it. Coming from a county commissioner's seat, I thought it was really good the way we divided the money up to the different counties. And so a lump sum money was set aside for each county. We started with which I was very much in favor of doing. I think when you give grants or money like this, it's important to come up with a base amount and then a per capita, because if you don't do that, it really kills rural counties like mine, because there's not many people, but you still have those base needs. And that's what we did. We came up with a base of $250,000 for all the counties. And guys, correct me if I'm wrong, I think that excluded Guilford, Wake, and Mecklenburg. Is that correct? Because they got money directly from the feds. They're over 500,000 in population. But so 97 counties got this $250,000. And then the way it broke down, if you backed that amount out of the 150 million, what was left, it's about $16.27 per capita. So that translated, all that said, translated my counties to Macon County got something over 800,000. Cherokee County got over 700,000, followed by Clay County, which was a little bit over 400,000. And then Graham, a very small population, there's just over 8,000 people live in the whole county, but they got the 250 plus the per cap made their check about $387,000, which those amounts, even though there was a lot bigger money in a lot of other things we did, the whole package was 1.5 billion with a B, and this was only 150 million, but it wasn't a huge part of what we passed. But I think it's important that money is made available to go back to local governments, because local governments are taking a hit on this thing, and the last thing we want to do is put counties in a position where they have to raise ad valorem taxes, which is their primary source of income, followed by sales tax. And they've been hurt by that a lot. So I think this money, and guys, I believe it was, correct me if I'm wrong, I believe that was half of the 300 million that's available. So we're not spending all the money right now. We're holding some of it back. And we're going to address more needs later. But the part of it that went to local government, I think, is incredibly important. And I think you guys would agree with that.
Well, and Senator Bergen, you serve on the Senate Health Committee and have taken a great interest in public health issues generally, even before the COVID-19 situation arose. What specifically in the package was intended to help address the public health aspect of this challenge?
Joe, there's a lot of money that's going to state and rural hospitals and to the whole hospital system, doctors, the total. I mean, our bill that we just passed was like $1.575 billion, but the total amount that we're going to be getting from the feds over all lines is closer to $5.8 billion. So we're talking about a lot of money, and and of course, all of it's supposed to be going to COVID and COVID-related expenses and additional expenses. So as we've been talking to, I've talked to the CEOs of a bunch of different hospitals. I was on the phone this morning with a group that helps folks that are Medicare and Medicaid dual eligible about their funding. And the fact that we didn't have a budget this year, a lot of things that we had put in the budget for different organizations, they never got those funds. So some of this money is going to backfill certain things. I mean, there was money in there for foster care. There was money in there for a number of different items that had we had a budget, they would have been in there. Now, in hindsight, not having a budget probably turned out to be a blessing, because we're probably going to end up somewhere between the 2 fiscal years about $5 billion short on revenues. I mean, nobody really has an idea yet of where we're going to be. Something that I've talked about a lot that I'm very concerned about is mental health in all of this. There are a lot of people that are experiencing a lot of mental health issues. Our local pharmacy in Angier told me that the number of antidepressants that have been prescribed is up 15% last month. And if you look across the whole state and say, well, if that's average, there's a lot more people that are being medicated to help deal with this. I've talked to a gentleman this weekend that he thinks it was stress induced, but he ended up having a heart attack and was in the local hospital. And then that created more stress because he's retired and his wife's retired, and they wouldn't let her see him. They told her that she couldn't see him. They weren't allowed to be together. So you look at alcohol sales are historic right now. You look at my sheriff tells me that drug use and drug overdoses is up. I don't have the most recent numbers, but in one article it said suicides are up. So all of those things magnify ongoing existing health issues. And I've asked the state, this is the 6th week, I'm hoping to have numbers this afternoon. I've asked them for 6 weeks to tell me how many people have died in the state of North Carolina that didn't have an underlying health issue. And so far they can't tell me a number, because early on we said that folks that have 65 and older and have underlying health issues need to be the people that we protect the most. And I think that some of the things that we've done, we could have waited on doing those if we would have dealt with those targets of folks that were the most affected. And then of course now nursing homes is the number one place where we're seeing deaths. We've had a number of deaths here that I talk to our health department every week, and we've not had any deaths in Harnett County that didn't have an underlying health issue, and the majority of our deaths now are in the nursing homes.
Senator Johnson, I know that you've always taken a keen interest in education-related issues, served on the statewide board for the community college system before being elected to the Senate. Within the COVID-19 legislative package, what are the key things that you think most significantly address the disruption, not just K-12, but to the community college and university system?
Yeah, and thank you, Joe, for that question. Can you hear me okay?
I can see.
I relocated so I could get a little bit better visibility. It was getting loud in there. I'll answer that question, Joe, but there's 2 comments I want to make real quick before I forget. Jim, or Senator Bergen, you brought up a good point about the mental health piece. I was speaking with my sheriff, and what I've had my sheriff doing is once a week updating me with counts on suicides, attempted suicides, Narcan, how many administrations of Narcan, domestic violence calls, child abuse calls, and the numbers compared to year over year or compared to last year. In some of those categories are more than double, in most categories are doubled. So severe downstream effects, kind of unintended consequences from this that will rear its ugly head. One other piece that I think a lot of folks, this goes back kind of to the education, not necessarily with the bill, but education. Being the father of a 14-year-old in high school, a 12-year-old in middle school, traditional public schools, these kids have been out of school for months, and part of being in school helps their immune system. And so by not having that interaction with other kids for a number of months, there's going to be effects from that. And sure, I'm fortunate to where my kids have health insurance, and that's not going to be a problem for them as bad because they'll get sick probably once they go back to school. There are a lot of families and a lot of kids that don't have insurance, so some big issues with that. But as far as the K-12 and the community colleges and universities, their worlds have been rocked. It's basically we're having to almost reinvent the wheel and figure out new ways of delivering services, new ways of trying to provide the services that, quite frankly, people have paid for them. You know, a lot of these community colleges, especially community college universities, parents and adults have already paid for these services, and having to figure out how to deliver that education to them, it's put them in a bind. So with this bill, there has been some relief in there. Is it over? Is this the one bill that's going to kind of fix it all? Probably not. There's going to be additional things that we're going to have to continue to work on. And I don't know if you've already spoken about this, since I was a little tardy to the party today. But the purpose, I think, at least from the Senate side, I definitely cannot speak for the House side because they were maybe a little bit on the other side of the spectrum. Not trying to pick at you, Mr. Corbin, but we were really looking to try to address the immediate needs in this budget, or in this appropriation, address the immediate need that we needed to get funding out into the communities for, but also understanding that we don't really have a clue of the true impact as of yet. There's people hurting, there's businesses hurting, our educational facilities are hurting. Let's get some money out to them to try to help them get kind of over the hump right now. But once everything kind of starts to settle down, then we'll have a better handle of what we really need to be appropriating this money for. And so we're hoping that the flexibility will come down from the federal government that will allow us to backfill some of these budgets. Because right now we can't use this money to backfill, this federal dollars to backfill. So we will have a better sense of the strain that's being placed on our universities, on K-12, on the community college system as we go forward. Keeping in mind that the community college system is 43% of the workforce in North Carolina has gone through our community college system. So 43% of the folks that are, I call them taxpayers. I mean, maybe that's not the cool thing to say, but they're training taxpayers. And that's how we are able to continue our state and continue the services that we're providing for folks. So we have to make sure that we maintain those institutions, maintain those delivery methods, even if this is a new norm. But Joe, I will tell you, I know I think that my colleagues in the Senate will tell you I'm the eternal optimist. I always try to look for the silver lining. With these trials and struggles that we've had over the last few months, we're doing a Zoom call here, which we probably wouldn't have been doing 2 or 3 months ago. Right. And so figuring out new ways, new doesn't mean better, but it also doesn't mean worse. And so new ways to have these, to get education, which might present an opportunity for more folks that thought that I can't afford to get in my car, drive, especially like up in the mountains and stuff. People may have to drive 30, 40 miles, and driving 30 miles in the mountains isn't the same as driving 30 miles down here. And so having a new way, so it's forced us out of our comfort zone and forced us to do and look at new ways of doing business and doing things. And I heard Senator Bergen say recently that, he's seen an increase in his customer service and the response that his customers are getting, because people are more focused once, you don't have the distractions of everything going on around you. So in the end, I think we'll be better for this. The education delivery methods may change, may alter a little bit, but I think we'll be okay and we'll be better for it in the end.
Well, Senator Johnson, you bring up an interesting question for each of you individually. In addition to your role as a legislator, you run an insurance agency. Senator Sawyer, we'll start with you. What different ways are you seeing that you're likely to do business going forward? Are you learning lessons from having to operate in this environment with COVID-19 where you've said, hey, you know what, this is a better, more efficient, more practical way for us to conduct business or market or interact with our customers, any of those sorts of things? What are you finding are the lessons learned so far?
Yeah, thank you. So the lessons we've learned so far is that we have a really great agency management system. we weren't really using it to its full potential. So we were paying for these services like texting or phone calls or Zoom calls, and it's all integrated within our system. And so it forced us to use the tools that we already had in the box and to use them to their full potential. So I'm grateful for some things. I think we've all had those nasty customers that come in, and so I'll say that my staff is very happy that a few of those can't come in, and they were wondering if we could keep the door shut for longer. But it is a loss of sense of community, because as a small agency, you begin to take care of your customers like they're your own family. And so there is that kind of loss of community. I do enjoy seeing them come in, and I'm ready to open the doors so that they can come and visit us a little bit. But that is what I've noticed is we've always been automated. We try to be paperless as much as you can be. And so just using the tools that we already had was something we probably would have overlooked unless it wasn't for COVID.
And Representative Corbin, as you mentioned earlier, you do a pretty considerable amount of business on the healthcare side. What sort of changes do you see going forward? Clearly, on the health insurance market, there will be impact from the expense associated with all of these folks and the various treatments and things. But are you finding that there are lessons you're learning in this that you'll apply in the future?
Sure. Our agency has always been, well, not always, but in the last several years have been, did a lot of internet sales. We use things like Google AdWords and things like that. So we have done a lot of marketing like is going on now. People mostly using the internet. So I do think that's probably going to be a little bit of the new normal. There's going to be more things done remotely, and up until, as I said a moment ago, this is a virus. It's not going to go away anytime soon without a vaccine. If the vaccine ever becomes available, and we're all prayerfully hopeful that it will, then I think we probably can return to some kind of normal business model. But until then, as my colleague has said, we're doing a lot of business on the phone. I would agree with Senator Bergen. We've continued to do a lot of customer service and internet sales. New sales have been pretty good. As far as the health insurance industry, we write primarily with Blue Cross Blue Shield North Carolina, but we also have pretty good books of business with Aetna, United Healthcare, and Humana. And I think you're going to see obviously some increase in health insurance claims because of this. Of course, the COVID-19, but the things that Senator Johnson mentioned a moment ago, the longer this goes on, the worse mental health issues are going to be, and domestic violence and all those kind of things. And all those things impact the insurance business in somewhat of a negative way. But I would agree again with Senator Johnson. I'm an optimist. I think we'll get through this, hopefully sooner than later. But what we're hearing from folks in Washington, and even there's some companies in our state that are working to come up with a vaccine. I've got to think that we're smart enough as a society to figure that out in the short term and get that on the fast track. And I've heard estimates that we could even have a vaccine available by November or December, which sounds like a long time away, but that'll be here before we know it. But if that vaccine can happen, then I think we will return to a little closer to normal. I don't think we'll ever go back. I was on the education committee in the House, and one thing I brought up to them is we need to think moving forward, how is this going to permanently change education, the way we deliver it? Difficulty in my area is when you talk about distance learning, that means somebody has to drive by and throw a textbook out because half of my folks don't have internet. And so it's really magnified that issue in my district, and I'm pushing my colleagues in the House, and I'll mention it to my Senate colleagues, that we need to put some more money into the great grants that have gone out. We've put a dabble of money into that so far, but it's been, we've got a few hundred extra folks hooked up in my region, but we're about 30 to 40% unserved in my area. It's the worst connectivity anywhere in the state, and it's the geography. It's a long way between houses. So that probably is the biggest issue in my district, because the governor's talking about wanting school systems to come up with a distance learning plan come this fall. Well, that'd just be worse than a nightmare for our area to have to distance learn. It just doesn't work here.
Senator Bergen, as you mentioned too, your agency is just part of your business interests. What are you seeing across the line in terms of different ways of doing business? Will you sell cars in a different way in the future based on what you've learned through COVID-19?
Well, we already do that. We do a lot of internet sales already. We do a lot of, we've done a lot of things like we go pick up people's cars and bring them back. As soon as somebody brings a car in to be serviced, we fog it with a chemical that's actually guaranteed to kill the COVID virus in less than 2 minutes. And then after we work on it, we fog it again before we take it back or return delivery to them. So we do things like that. But some of the things that you know, they say if it doesn't kill you, it makes you stronger. Well, this is going to make us stronger about a lot of things. I serve as president of one of the agents' councils, and I've been on conference calls with different companies. And you know, one of the big companies in Raleigh just announced that they're going to close their huge office there, 2,200. I think it'll hold 2,200 people, and they're going to close it by November and let their folks start working from home. Another company told me that they were going to, in the past, they had about 20% of their people that worked at home part-time. They're going to up that to 90%. And so you're going to see a big decrease, I think, in the value of commercial real estate. So we need to be aware of that. We also need to be looking at just small businesses. I've had numerous calls, folks calling in Little Angier here wanting to know if they can rent buildings. They want to open a coffee shop or something. People that have been out of work and have had months to think about what they want to do with the rest of their lives are thinking that now might be the time to start a small business. So we're getting inquiries about that. You know, the technology is amazing. We already were doing DocuSign and all of that, but now we pretty much do everything electronically. We send stuff, we get it back. Right now, I don't think it's going to be permanent. I hope we don't make it permanent. I'm sure some people are pushing, but you know, you can even notarize documents electronically now during this. So there's going to be a lot of changes come out of this. There's going to, and I think a lot of them will be better. Telemedicine has really taken off. We had been talking about that for the last year and a half about telemedicine, and now I mean people just expect it. So I think you're going to see that and what that'll do with healthcare and healthcare related. One of the things we did early on is we went in and we contacted our folks, sent out emails, put it on our Facebook and website and everything, saying if you're not driving back and forth to work, call us. We want to change your car to pleasure and save you that money. And I want to give a big shout out to a lot of the companies. The companies have really stepped up and done some great things. They've given, some of them given like 15% off. One company just mailed out $50 for every car that you have on your personal policy. I actually got a check in the mail from an insurance company yesterday. Other companies are making large donations to charities, and one that I've been helping on a situation, they're donating $3 million to charity because of this. So the companies are doing things that contractually they don't have to do. So I'm proud of them and proud of the relationship we have with our companies, and all of us need to be thanking them for being sensitive to people, especially in their needs right now.
Well, and Senator Johnson, you referenced early on that you started as an insurance agent when you were 13. So been in the business now about 10 years. And so
Yeah, right. That's right.
so as you start to think about your agency and the business lessons that you're learning through this, any different approaches that you're going to take going forward?
Well, we've been pretty fortunate through this whole thing. Our agency has pretty much operated very similar to what we've always done. A lot of our business is done on the phone. We write, whereas, you know, Representative Corbin writes more health. I know Senator Bergen writes a lot of commercial business. We do primarily home and auto, and our emphasis is on home insurance. So a lot of that's written over the phone anyways. So we have maintained our offices. Our offices are open. The only thing we've really done differently is we did install the little shield in front of all of our agents' desks. And but we do a lot of the DocuSigns and transact business over the phone. When my colleagues were speaking, I made a few notes of stuff that I wanted to make sure I went back. And so before you cut us off here, Joe, I want to mention a couple of things. Senator Bergen mentioned buying a car online. I had the privilege of buying a car from him not long ago. I didn't do it online, but I did it over the phone. It was super easy. I showed up, they handed me the keys, I signed a few papers, and I was on the road and within probably 10 minutes. So he's got a really smooth operation, does a really good job, and takes care of his people. So Jim, keep up the good work. You're doing a great job on that.
You get a discount on the next one.
All right, sounds good.
Cheap
One other thing is, earlier in my comments, I talked about file cabinets, and when I was back when we used to do file cabinets, I didn't look at Kevin Corbin's backdrop and see that he's got a whole bunch of file cabinets. So I wasn't picking at you, Kevin. I know up in the mountains it's a little slower to get up that way, but I didn't mean to insult you or anything. If that was an insulting comment, it wasn't meant to be. The telemedicine, if nobody's ever tried telemedicine, I would strongly encourage you to do it. My son got sick. This was before all this, but it was on a Saturday morning. He didn't feel well. I could tell he had a little bit of fever. And so I said, you know what? I was at Rotary Club that week, and somebody was there talking about telemedicine. Quite honestly, I didn't know a lot about it. So I said, I'm going to give it a try. It was really, really neat, and they were able to help him. And so I'd encourage anybody, especially now, if you don't feel safe getting out doctor's offices, that's where sick people go. So it's good with the telemedicine, allows folks to be able to stay at home. And I do know there's been some legislation around reimbursements and stuff surrounding telemedicine. We got a lot of work to do in that realm, but kind of the change in the way things are going. And one last thing that I think is very, and probably the most important thing of any of the comments that I've made today, since I've changed venues to where I'm not in the dark hole that I was in, I've gotten a couple of different messages about this. Right, let's see if I get my cigar Indian that's outside. I don't know if you can see it. I'm not going to tell you my address because I've been told by a couple of people that they were going to come pick up my cigar Indian that's in the background there. So, but other than that, I appreciate you, Joe, and appreciate you letting us get here and chat a little bit.
One of the shortcomings of this new way of conducting business, these video conference meetings, is you have to be more diligent about what's in the background of where you are to make sure that you're doing something.
That is very, very true. I think I'll go to San Francisco then. How about that? Huh?
Is that bridge in Union County? I'm not familiar.
That's right across the road over there.
Bridge there.
Well, be respectful of your time, and thank you so much for joining us in this installment of the Town Hall Tuesday. I start with you, Senator Sawyer. It doesn't have to be insurance related or even COVID-19 related, but something you're working on legislatively that you hope to get accomplished this year. At some point, we're thinking that the legislature will come back into a more usual short session where a variety of issues are taken up. But just if you would give folks a sense of maybe what your top one or two priorities are legislatively for 2020.
Yeah, so we still continue as an agency to support, or as most of us on this call, to support the hands-free legislation. So we do have that on the Senate side. Maybe we can get some movement on there. And thank you, Joe, for all your work on that. And also, I'm really diving deep into the North Carolina Department of Transportation, and just Google it and check out their budget woes right now. And it's quite a mess, and I'm excited to try to figure it out.
Senator Johnson, on your agenda.
There's a number of different things, kind of actually more insurance related, sort of, with the changes. And maybe this is because I have a 14-year-old fixing to turn 15 in June. With the schools being closed, what we've found is DMV is very, let's just say, very paper intensive. And so if a kid wants to go and get his permit, they've done all the driving schools and stuff like that, and they want to go get their permit, they have to get what it literally is a 3-ply, the old school 3-ply, where you got the yellow copy and the red copy and the white copy, and you have to go to the school and they have to fill it out by hand and they have to seal it and then give a kid the copy, and then that kid can go to DMV. Well, the problem is the schools have been closed, so therefore they can't get these pieces of paper. And so you've had 2 to 3 months of students that have not been able to get their permit. And that's not really the problem. The problem is statutorily, they have to keep that permit for 1 year. So not only are you delaying the permit, the real problems are going to be next year when the kid's ready to get their license. So their birthday may be, but they're really not going to be able to get their license until June or July or whenever the schools are actually going to be back open. So working on some legislation to streamline it and make that more of an electronic process, and getting away from the 3-ply paper and kind of the old way of doing things. Some stuff with that. There's some other more technical things that I think we need to work on that I've got in the hopper. And but other than that, I think you'll probably see a more. I won't say it will be a normal short session starting next week, but hopefully, I know we've got commerce and insurance on Monday at 2:00. It's nice to see our committees kind of picking back up. So, because even during all of this COVID-19 thing, all eyes have been on that, but there's still regular business that we have to start working on. And it's like cooking. You can't leave stuff on the stove for too long or to get burned up. It is still cooking whether we're paying attention to it or not. So hopefully we can get back to some form of normalcy next week and start getting some of these issues addressed that we definitely have brewing.
Senator Bergen, on your legislative to-do list.
Of course, hands-free is the top on there, Joe, and it's about a lot of things. The healthcare, it's real interesting. I've been talking about CON. I like your new sign there. That's great. The first thing that the state did when all this started was they eliminated a lot of regulations that are in the CON. So that tells you they even recognize that those are impediments to good schools. So I want to dig into that and start looking at CON, removing some of those items and getting that done. The technology. I think the technology in this state, it's been amazing. Did you know that DHHS cannot tell you, we're only one of three states that they can't tell you how many people died each day. I've been asking for numbers from April 1st till originally it was April 26th. I say now whatever current date, and they say we don't get automated death certificates in. And we're only one of three states that don't do that. We saw what the problem was with unemployment. I mean, it was technology. The first thing they did was they switched platforms. They had to expand everything. The folks at IT were telling me all the things they had to do to try to improve service. So I think we, as legislators who deal with technology for our businesses, we need to demand that the state have similar technology, and we need to do it at our prices, not government prices. That's been one of the big things that I've been discouraged about, is how much money the state and government in general spends on something that we as business owners do, but we don't have to spend that much money on it. There's been over $1 billion spent on NC Fast, which accumulates data from all the social services across the state and everything. And you know, there is no way that much money should have been spent on a program to collect data. There's people that are a lot smarter than me that can do this and not spend near as much money, but I think we need to dig in on that. And then one of the things that I've been pushing since I got up there is I don't think we ought to be charging state income tax on military retiree pay. A lot of people are going to say now's not the time to do that, but I think it's always the right time to do the right thing. And I think we need to say we are going to be one of the most friendly military states in the country, and charging state income tax on their military retirement, I think, is wrong. So I'm going to be pushing that again as soon as I get back.
All right, Representative Corbin, you get the last word. What's on your wish list for the 2020 legislative sessions?
I noticed that Senator Johnson was making fun of my file cabinets back here, and I see that he's moved into the stratosphere. I'll leave that alone for that. But yeah, I agree with my colleagues. I mean, hands-free NC, unless you lived under a rock, you were aware that got a lot of publicity for us last term. And as you know, I introduced that bill in the House. It had never gotten any traction at all. I believe I'm right. I don't think it even had made it out of the committee ever. So we went through the committee process. We had some struggles. There were some folks in leadership who were very close friends of mine, and I have no criticism of them, but we're not for a hands-free bill. I think that attitude has changed a lot. We did get it passed through the House, as you know, and it's over in the Senate now. So I'll hopefully be dependent on my Senate colleagues to get that moving over there. We're going to give that our best shot. I think moving forward for me, my priorities pretty much have always been constituent service. I introduced a lot of legislation. I've had a lot of legislation that I've gotten passed, but constituent service is really important right now. And I think my colleagues would agree. Folks, they want to be able to call their representative or their senator. And I told somebody the other day, it's gotten down to where I'm only getting about 100 phone calls a day. It's sort of manageable now. It was crazy for a while. And I think everybody I know has applied for unemployment, and about 50% of them haven't gotten it. And that's some frustration. And you know, we don't want to criticize the folks at Commerce. They've been, I told somebody yesterday, it's like 1,000 cars trying to get onto the on-ramp at the same time. You know, there's going to be 2 or 3 make it, but most people are having to wait in line. And that's kind of a tough deal. One thing I would like to mention is our DHSS, we've been pushing them to give us recovered numbers from this COVID-19. It's important to know how many people are sick. It's certainly important to know, and we grieve over those who die, and we got those numbers. But I want to hear how many people have gotten it and are back walking around again. And they did start reporting that in the last, I think yesterday, before. And we've got about 10,000, isn't that right? About 10,000 folks that are showing as recovered, I believe is what I saw earlier today from Matt Gross at DHSS. So anyway, just want to thank you, Joe, for putting this together and having us on your program. I always enjoy it.
Well, I appreciate it. Senator Johnson, you pinged me. You said you had one final thing you wanted to mention before we signed off.
Yeah, I'm sorry. One last little thing that I think anyone that's listening that's in the insurance industry may find it interesting, may find it not to be beneficial. But Senator Sawyer and I we went, a few months ago, we went down east and started touring some, it's 100% her idea. She just let me tag along. And we started visiting some insurance agencies because we just want to hear, we know what goes on in our own agency, but we want to talk to other agencies and see some concerns. And one thing that stuck out in my head that I've already started working on trying to get addressed is brokerage licenses. And so anybody that writes brokered business through, say, a Strickland Insurance Brokers, Johnson & Johnson, JSA, any of those folks, trying to maintain a broker's license for each individual agent, and having to buy bonds for each individual agent, pay licensing fee for each individual agent, and how that is can be cumbersome, especially if you get to maybe a larger agent where not necessarily turnover, but you got a new person coming in, somebody going out. Trying to come up with an avenue to have an agency broker's license, so kind of a blanket umbrella broker's license that will cover anyone that's up under in your agency that's an employee of your agency, or even a 1099 still be able to do licensing like you do now, but also have another option to where you could buy a broker's license just for their agency. So anyone that works at your agency would fall under the protection of that broker's license. So figured we're working on it. Not sure we can get it across the finish line, but that's something I'm working on right now.
Added it to my legislative to-do list. Thank you, Senator Johnson. And Senator Sawyer, Senator Bergen, Representative Corbin, thank you so much for being a part of today's Town Hall Tuesday. And thank you for all that you do to help not only independent insurance agents across North Carolina, but thank you for your service to the citizens of North Carolina.
Thank you.